Everyone wants fresh breath, but relying entirely on a standard morning routine of brushing and flossing means that clean feeling rarely survives past lunch. When that stale taste hits, the common instinct is to escalate. We reach for stronger breath mints, aggressive alcohol-based mouthwashes, or simply scrub our teeth harder to overpower the problem. Chasing the symptom with a stronger mint is a losing battle. To maintain baseline freshness all day, you have to stop masking the odor and start using it as a diagnostic tool to locate the exact biological failure point in your mouth. This flowchart represents the fresh breath diagnostic. Instead of guessing, we can trace halitosis back to 3 specific categories of origin. Those categories are your dietary and chemical inputs, your mechanical hygiene failures, and underlying systemic roadblocks. Pinpointing which of these 3 paths is causing your bad breath dictates exactly how you treat it. It stops you from throwing money at expensive mouth rinses that have zero chance of fixing a structural dental issue. Achieving a truly healthy mouth is a matching problem. You have to pair your specific chemical or biological cause to its exact required cure. Let's look at the first diagnostic path, the daily dietary and chemical inputs that alter your oral environment. Consider your standard morning coffee or an evening cocktail. Both caffeine and alcohol severely restrict saliva production, leaving you with an intensely dry mouth. Without saliva to wash away bacteria, oral debris begins to stagnate. Alcohol creates a secondary problem. As your body breaks it down, it converts into acetic acid, a compound that directly produces a foul, lingering odor of its own. On the other end of the spectrum, we have highly nutritious superfoods, like cabbage, garlic, and eggs. They do not dry your mouth out, but they introduce a completely different variable. These foods are packed with sulfur. Digesting them releases unavoidable sulfur compounds, the precise chemical profile responsible for a rotten egg smell, straight into your breath. This comparison table maps out these specific lifestyle choices side by side. Coffee and alcohol create an arid, acidic breeding ground for bacteria, while superfoods directly inject pungent sulfur gas into your system. You want the health benefits of vegetables and the social joy of a drink, which means you must accept a compromised oral biome. The solution is not to eliminate these items, but to actively mitigate the fallout with targeted hydration and pH management. You manage dietary halitosis through strict water intake and timing your routines, allowing you to maintain your lifestyle while neutralizing the chemical byproducts. If your diet is managed, we move to the second diagnostic category, the hygiene optimizers. This focuses entirely on the mechanics of physical removal and saliva stimulation. A standard toothbrush is designed for hard enamel, not the soft, porous surface of your tongue. To upgrade your routine, you have to implement deep tongue scraping. Your tongue harbors a massive amount of decaying food and bacteria, especially near the throat. Physically scraping this surface pulls that deep-set, odor-causing layer out of your mouth entirely. The immediate trade-off is comfort. To do this effectively, you have to reach far enough back to trigger a physical gag reflex. Enduring that brief discomfort yields the highest objective return on investment for your daily breath. Alongside physical scraping, you need the right chemical interventions. That requires throwing away alcohol-based mouthwashes and switching to products containing xylitol.
Xylitol is a unique sugar alcohol. Chewing xylitol gum rapidly stimulates your salivary glands to wash away debris, but its chemical structure guarantees cavity-causing bacteria cannot feed on it. This quadrant chart plots these specific hygiene tools by effort and impact. Tongue scraping requires high physical effort, but delivers massive impact, while popping a xylitol mint or using a non-alcoholic rinse requires almost zero effort for a highly effective biological reset. Used together, these tools physically extract the odor source and chemically break the chronic dry mouth loop caused by harsh traditional mouthwashes. Proper oral care does not mean scrubbing your teeth harder. It requires precise tools that physically drag bacteria out of the body and biologically restore your mouth's natural pH balance. For some, a perfect diet and flawless hygiene still leave a foul taste. That brings us to the final diagnostic category, systemic and structural roadblocks. Sometimes the source is a localized physical defect, A common example is a food trap, which frequently occurs when a dental crown is over-contoured and does not sit flush with the adjacent teeth. This structural flaw pushes the gum tissue down, creating a tiny, inaccessible void between the crown and the gum line. Food gets wedged into this gap, and because you cannot reach it, it sits there and rots. Fixing a food trap requires the financial and physical cost of seeing a dentist. Completing that dental work permanently eliminates a severe, localized source of decay. If the teeth are structurally sound, the diagnostic path moves downward. Conditions like acid reflux and GERD push digestive gases and stomach acids back up through the esophagus, creating an odor that originates far below the mouth. Higher up, in the back of the throat, we find tonsillar crypts. These tissue pockets trap bacteria and food debris, which compress over months or years into hard, intensely foul-smelling clusters known as tonsil stones. When the smell is radiating directly from deep within your digestive tract or calcified in your throat tissue, dissolving a breath mint on your tongue is absolutely futile. If your halitosis persists despite impeccable brushing and dietary discipline, your problem is structural. Buying another bottle of over-the-counter mouthwash at this stage is a complete waste of capital. Bad breath is a symptom. Your investment of time and money must directly match the root cause of that symptom. We can now return to the complete fresh breath diagnostic framework and map out your required action plan based on your exact profile. First, we have the baseline optimizer. Your oral hygiene is generally good, but your breath gets stale by the afternoon. Your protocol is the high-impact, low-effort stack. Add deep tongue scraping and chew xylitol gum after meals to stimulate saliva. Next is the culinary enthusiast. Your halitosis is directly tied to the sulfur-rich superfoods or alcoholic beverages you consume. Keep your diet, but immediately post-consumption, enforce high water intake and use a non-alcoholic mouth rinse to restore pH balance. Finally, the chronic sufferer. You brush aggressively and watch your diet, yet a severe odor persists. Stop buying retail hygiene products immediately. Your exact protocol requires a targeted consultation with a dentist or doctor to locate the hidden food trap or GI issue. Abandoning the generic morning routine in favor of a targeted biological diagnosis is the only practical way to stop masking odors and achieve permanent, consistent freshness.